a very good question to start with. It's the transition between regular, fertile, expected menstrual cycles and menopause. So it is a bit like puberty, which is the transition between childhood and adulthood.
Mhm.
It's full of chaos. It's full of inflammation, and there's both a social and personal as well as a physiological transition to go through. And the combination can be very difficult for some women. However, the majority of women have no major problems.
Mhm.
I think that's important to remember because we kind of make a disease out of it. And it isn't. It's not pleasant. In fact, I had such a difficult time. I don't think I've ever been quite so miserable. And yet it's normal.
Mhm. What is the age range we're generally looking at? Because I see women coming to me with complaints in their mid 30s. Now I know some of that can also just be very stressful times in their lives, but I know it's not completely uncommon for a woman to start perimenopause that young either.
Okay. So the outside range is 35 to 57. Uh, Both are rare. Both the outsides are rare. The usual is to start in the mid 40s to late 40s. That's when most women have symptoms if they're going to. And again, the things that the I don't call them complaints. I call them experiences, unwanted experiences, true. But when you say symptom, it implies medical intervention is necessary. Okay. Um, what is surprising is waking suddenly in the middle of the night, in the middle of a sound sleep, is one of the most common things that women experience.
Hmm.
And another extremely common thing that perimenopausal women experience is heavy flow. That and associated with that increased menstrual cramps.